Okay, so let's talk a little bit about some discomforts of pregnancy that can affect nutrition. In the first trimester, nausea and vomiting are common. So what are some things that might help help those and promote nutrition? Bland, dry carbs before getting out of bed. The stereotype is we keep some saltine crackers on the bedside table. That actually can be very helpful. So putting some bland, dry carbs in the stomach before they even move. One thing that I actually encourage people to do is eat whatever food sounds good right now. If something sounds good right now, sometimes it will settle the stomach enough that they can get something more nutritious in. So even if, if chips sound good, eat a few chips, see if it settles the stomach, and then try something a little healthier. We want, again, within reason, and it needs to be food, please. The smell of lemons or mint can help. Ginger can help with nausea. That's why we drink ginger ale. Vitamin B6 has been effective for some people. Acupuncture or acupressure, there's not a lot of research into that, but C-bands, the little acupressure wristbands, a lot of people really report that they have relief from that. There are antiemetic medications, so if those home measures are not helping, we need to encourage the patient to contact their provider, because there are some meds that can be safely taken in pregnancy and help that nausea, vomiting. If it's severe, the patient may have to be hospitalized for IV hydration or even TPN. If they're needing TPN, we're not having morning sickness. That's hyperemesis gravidarum. That is a complication. Another potential discomfort in pregnancy is constipation. Constipation can eventually affect the nausea, vomiting, and the appetite part. So for the constipation, we want to encourage fiber, fluids, activity, regular bowel habits, and then if they're going to be taking anything to promote defecation, it needs to be something that's safe in pregnancy. Usually we're going to encourage either increased fiber with fluid, so a fiber supplement, or polyethylene glycol, or a stool softener of some type. Pyrosis is heartburn. Heartburn is caused by loosening of that esophageal sphincter. So we want to encourage them to eat smaller, more frequent meals, because if the stomach is over full, it'll push that acidic junk up in the esophagus more easily. We want to encourage them to consume fluid and foods separately. So eat food, give it some time to digest, have fluid and foods in the stomach at separate times. Acidic, spicy, and fatty foods may make this worse, so we want to encourage them to avoid those. We want them to avoid lying down immediately after eating and avoid tight clothing. Okay. I'm going to come back and talk about some special nutritional circumstances, including nutrition in lactation, in the last video.